Hi, I'm Andi Skilton. I'm the Senior Research Associate for Patient and Public Involvement with Research at the Moorfields Biomedical Research Centre, which is a horribly long title. I'm going to talk to you about public involvement and in a slightly different way to perhaps it's been referred to elsewhere in the discussions today. I will stress that I'm normally one of the people in the green t-shirts at the back of the room rather than up here, and I normally talk directly to doctors. So actually to stand here in front of a room of people who are the experts in a condition is very nerve-wracking. So what do I mean by public involvement in research? Well, in the health sector, what we mean by that is about bringing together those who have a condition and the doctors and researchers who work on the scientific side of the condition and bring them around the table to have a mutually beneficial conversation. And my role is to act as a neutral facilitator in that process, and I do that with a team of fantastic people at Moorfields, which Katie and the BRC team are part of. What I mean by mutually beneficial is that, and I think what we've touched on in so many ways today, is that it is no longer good enough to just simply take on the perspective of the people treating a condition. Nobody knows your condition better than you do, and you can really talk to the impacts, to the challenges, and to what's actually needed. And it's really important, and we are now finally starting to listen to that process. We're seeing across the board in numerous different conditions now that this process of two-way conversation is actually starting to change the way in which research is done. Research is proving to be much more high quality and much more beneficial and relevant to those people. So as Katie said, you've already actually started this process by taking part in the Living with Blepharospasm survey that was sent out to some of you before today and which the rest of you picked up. And that survey is seeking to capture the real world insights from all of you who are living with blepharospasm. What I'm going to do just briefly in my talk, because I'm in the very fortunate position of actually having had a lot of what I'm about to touch on already be covered today. So I've got the nice job of surmising it up for everybody, but then actually handing the floor back over to you so we can actually hear what you have to say. So these results from the surveys we've had in so far are preliminary. They're preliminary because I'm urging for any of you who haven't yet handed in your survey, please do so. You're about to see how valuable those results are going to be to us. We have the live wall out there. We've had these discussions throughout the morning. All of that conversation is contributing to a better and more full understanding of what blepharospasm means. So we've had 32 surveys back so far, and I'm going to be bolshy and say it's not good enough. The reason it's not is because what you're about to see and the results that I've summed up for you are the loudest voices, the voices that have shouted the loudest so far. If we want change, if we want to make improvement, we need to hear from every single voice. Some of the things that we've touched on in the discussion today haven't even come up in the survey so far. Surgery hasn't been covered yet. Hearing hasn't been covered yet. It's important we know every single aspect if we're going to do things better. So I'm going to focus down on two of the questions. The first question, question 11, is the question that Dolores touched on earlier in her talk, which was the question from the Priority Setting Partnership in Sight Loss and Vision. Now, I'm going to say that no questions on blepharospasm were ever submitted to that survey. So this really is your opportunity. We haven't heard your voice before, so shout loudly. And then question 12 from the survey, which is on your experiences of the NHS to date with living with blepharospasm, which, as you can imagine, is quite an interesting one. So questions for research. So far, there are 4 very core areas that are falling out of the survey and a top question. So causes, triggers, and progression. We've touched on that today, and we've touched on this. What is the cause of blepharospasm? So this is what people's top question in this field was, and this was closely followed by, will there ever be a cure? Treatment and management. Unsurprisingly, questions on alternatives to Botox and the management of Botox came along a lot. People wanted to know, is Botox the only option? Some people had only ever been offered Botox. Can or is Botox being managed as effectively as it could be? And I'm going to come back to this at the end of my talk and open up for a bit more discussion. relationships to other conditions, and we've already heard today about that relationship between blepharospasm and dry eye. I think what's very clear from this is perhaps this is something we know a lot about, but there's a lack of information. You're not being told what the link between your blepharospasm and dry eye is, so maybe there's more work that we can be doing there. Alternative therapies and self-management, and I've had some lovely conversations with people today about this process. We've talked about mindfulness, relaxation, stress. Somebody mentioned neuroplasticity earlier today. Lots of people were asking, what else can we do to manage, but to self-manage, to take some ownership of blepharospasm and take some control of it back ourselves. So NHS care challenges. Now, I want to stress right now that this wasn't all doom and gloom so far. Some people have reported very positive experiences, that they feel managed, they feel controlled, they've been incredibly complimentary about GPs, neurologists, ophthalmologists, and the support they've received. But unfortunately, that isn't the case for everybody. And I want to champion that the purpose of today and the purpose that we have so many engaged clinicians and patients in the room together is that we can make this bit a lot better. So diagnosis and referral for care came up a lot so far. People talked about slow or misdiagnosis. A lot of people mentioned this idea of a lottery of care. People felt they weren't getting consistency in their treatment, and that was very much dependent on where they were being seen. A lot of people talked about slow to refer or self-referral, and again, we had this morning about people feeling very fortunate if they had the ability to get themselves referred, to be seen privately, to get access to treatment and care that they felt that they needed. So this came up a lot as well. Again, treatment and Botox came up a second time, and very strongly again in this question. Often Botox presented as the only approach, and people asking, is that true? A lack of flexibility, we've come across this again already today, and this study that Dan is looking at, which right now is about whether you can contact your clinic and come in for a Botox treatment when you need it, rather than living with very difficult symptoms for a month before your next appointment. A lot of people have touched on that. And a lot of people have touched on individualization of treatment. We all hear about personalized medicines and about treating each patient as an individual. And a lot of people are feeling like it's a bit of a one-size-fits-all solution, and perhaps people aren't getting drilling down into what their actual needs are. And then finally, isolation and access to support. A lot of people have said that they don't feel like they got enough information when they first got diagnosed about the management, about what blepharospasm was. A lot of people have also talked about no counselling was offered, no peer-to-peer support. They hadn't even heard of the Dystonia Society at that point, for example, and this lack of connecting people. And again, this is something that, hopefully some of you have taken the opportunity to today start forming some connections with other people that you can talk with about having blepharospasm. So those are what's come out so far. But as I said, these are the loudest voices. These are the voices who have stepped up so far. And I really want to hear from every single voice. So if that survey is hidden away in your bag and you haven't even opened it yet, do so, fill it out, get it back to us. You have the rest of this year, so that we can really narrow down into what's needed. This idea of patient involvement in research and conversation is so important. Now, we can't address everything at once. We simply can't. But what we can do is start prioritizing what needs to be tackled first, what the priorities are, and where we should start focusing in.